Hello, everybody. Let's talk about differential diagnosis and some of the steps involved. Now, these steps are broad-based steps. Every kind of DSM category has their own differential diagnoses or differential diagnosis tree or table that can be used. You can sometimes find those online. The APA actually produces a differential diagnosis tree or differential diagnosis step-by-step manual that can be used. But I'm going to cover at least the broad steps for doing a differential diagnosis in this video. And then during our weekly sessions, we can talk about the specific tree that corresponds to the diagnostic categories. So step number one in doing a differential diagnosis, you want to rule out malingering or factitious disorder. For those who have never heard of malingering is when you have a client or a patient who is being very deceptive or even feigning, making up their symptoms in order to achieve a recognizable goal. I've had clients throughout my career who are looking to either get on some sort of state assistance or get on some sort of disability or claim short-term disability. And all of a sudden they're kind of saying, hey, Nate, I need you to fill out this form so I can get X, right? So I can get food stamps or so I can get on housing or so I can get on disability. If they're coming in and they start describing their symptoms so that they can achieve a certain goal, that's particularly malingering. Now, if they've had this disorder for quite some time, or that you know them and you know they've experienced this, and then they are applying for some sort of disability or benefits, that's a different story. But you may see clients that come in and they have a goal first, and then they're going to try and weave in some symptoms in order to get you to diagnose them so that they can get that particular benefit. That is malingering. That's why that's the first step in a differential diagnosis, is that if they're malingering, then it's not appropriate to give them the diagnosis. Number two is factitious disorder. This is similar to malingering in that there's deceptive behavior going on. They're feigning the illness. But in this case, there's no real goal other than to kind of be treated and kind of mimic the symptoms of others. Maybe they've got other family members, or maybe they've seen it on TV. And so they're kind of saying that they have this disorder or having a particular disorder. But when you get in the clinical assessment and clinical interview with them, you're finding that they're having a hard time being a historian of when it started. They can't provide much context or really any descriptions, accurate descriptions that define the symptom that they're saying that they have. And so a factitious disorder, again, is a person coming in, they're being kind of deceptive or being kind of really suspicious as to their description of what they're suffering from. In previous DSM diagnoses and manuals, one of the criteria is that they had to be attention-seeking. I believe they removed that for the fact that some people necessarily aren't wanting attention as much as they're coming there and they're saying that they have a disorder, but really it's not fitting, and that's where the differential diagnosis stops. Step two is to rule out any sort of substance use or withdrawals symptoms. The reason is if their symptoms that they're experiencing and expressing to you is due to a substance, then it wouldn't be appropriate to give them the full mental health diagnosis that you would give to another person that is experiencing that without a substance being the contributing factor. So the question you want to ask is, has the client recently used a substance, or are they withdrawing from a substance? The way you get at that is to simply ask them, have they recently used a substance, or are they coming off of a substance? That is the way to get at that. Some of these substances include drugs, illicit drugs, in some states, medicinal marijuana and other things can induce certain symptoms. And so whether it's illicit drugs, illegalized drugs, alcohol, certainly, and or medications. These medications can be physical for physical symptoms, such as heart medications and other things, or psychiatric medications. Pretty much every medication has some sort of side effect and almost has some sort of psychological side effect, whether it's anxiety, depressed mood, hyperactivity, whatever odd behavior. So we need to know, have they recently used drugs or alcohol or been recently kind of started on a medication or coming off of a medication. Another thing we need to consider, or three considerations when deciding whether or not it's due to a substance, is number one, were the symptoms already present prior to using the substance? That's a key way to know. Were they experiencing depression earlier or way prior to then using some sort of substance such as alcohol or some sort of other medication or something to that effect? So, were the symptoms present prior to the substance? Number two, does the particular substance, the type of substance or drug or medication, and the length of time relate to the symptom being experienced? So, if a person's saying that they took a vitamin or some sort of thing, and all of a sudden they said they had intense anxiety, you're not a physician, and so you're not a medical professional, but you're really trying to also determine, is the type of thing that they've used, is that common that they would experience symptoms such as that? Um, in those cases, we probably would defer then to refer them to a medical doctor to where they could diagnose that specifically. But nonetheless, we can have some pretty good ideas of the substance and whether it corresponds to the way that they're acting. And how long is another thing. Is if they recently used alcohol and they're coming off of it, it should correspond to that timeline. If they've had a drink a week ago, but now they're experiencing anxiety, alcohol's been long out of their system for a week. They haven't drank since then, and now they're experiencing anxiety. Those things, the duration says that it really isn't matching up. And number three, is there some other alternative explanation? Meaning, do they have a depressive symptoms prior to using this substance, and the substance is part of coping? So is the substance use part of already an explanation? Do they have a family history or medical condition that's already there, and substance use or medication use is already part of their established diagnosis? So in that case, yeah, they might have an alcohol use disorder, but the primary diagnosis, for example, might be depression or anxiety. And then they're using a substance on top of that. So we've got to also look at kind of what came first, the chicken or the egg, and how it's being used. So those are usually kind of the three steps that we need to look at. Number three in the differential diagnosis steps that we need to look, generally speaking, is we need to rule out general medical conditions, or at least see if it might be due to a general medical condition. So similar to the substance abuse kind of questions or determination, ask yourself as a clinician, were the symptoms present prior to the onset of the medical condition? So did they already have anxiety, depression, panic, bipolar disorder symptoms, hallucinations, whatever, prior to the medical condition or after the medical condition? That's how you start to differentiate between this particular step and a mental health disorder. So did the symptoms resolve after the medical condition resolved? So that's the other question. So if the medical condition resolved and then the symptoms resolved, then we can have a pretty good understanding or pretty good idea that it was likely the medical condition that was contributing, the main contributing factor to the symptoms that we're seeing in front of us. So that is another question. If after the medical condition resolved, did the symptoms resolve? I gave an example, I think, in another video, that I had a client that was suffering from depressed mood, lethargia, lack of motivation. I referred her to her physician to kind of check on her thyroid, because she expressed that she had a family history of thyroid issues. Lo and behold, she was put on thyroid medication. The depressive symptoms cleared up. She had energy. She was motivated. Her depressed mood lifted. So that would be an indicator that this was a medical condition that was causing these kind of mental health symptoms, and that it resolved after the medical medical condition was treated or resolved. Um, it might be a medical condition if the symptoms are atypical. So you want to look at the pattern of the symptoms, the age of onset, the course of the medical condition. And so, if all of a sudden an 80-year-old man is experiencing anxiety out of the blue, it's probably not likely that all of a sudden he developed generalized anxiety disorder or some sort of panic disorder. It's probably more likely that it was a medical condition, given his age, that it has to do with some sort of neural processing disorder, possibly dementia or Alzheimer's. It's not far off those with Alzheimer's or kind of mid to late stage dementias where they get agitated, they get irritated, they're using foul language, they're sometimes violent, potentially. That necessarily has nothing to do with a mental health diagnosis, as it is the medical condition that's contributing to those, what looks or appears to be a mental health diagnosis, but it's a medical condition. So you need to kind of look at the age and stage of life, the course of these symptoms, and whether or not it fits with where that person is in their life. Did it all of a sudden come on out of the blue? Is it more very acute, or the chronicity says that it has been a long-standing problem for years and years and years? And that'll help you decide and differentiate between a medical condition and a long-standing condition. You'll want to refer always to a medical provider to determine the etiology or the kind of the beginnings or the source of the cause, especially for a medical disorder or medical condition. Never go out on a limb and say, oh, you must have dementia, or you're suffering from Alzheimer's, or you're suffering from hypothyroidism. Don't be going out and diagnosing and practicing medicine. It's one thing to say, oh, you have a family history of thyroidism. That can sometimes be a contributing factor. Let's have you go and have a medical evaluation to see if anything medically might be causing these anxiety symptoms or depressive symptoms. But never go out and tell them they have a diagnosis, or that a certain diagnosis is causing, or a certain medical condition is causing their symptoms. We just can't do it. It's way out of the scope of practice, and that will jeopardize your license and your supervisor's license and liability all over the place. So let's not do that. Okay, this is the first part. The second part, we'll talk about the last several steps in the differentiation or differential diagnosis, generalized steps for determining whether or not it's a mental health disorder or possibly something else.